I'm Dr. Richard Harding. In the spirit of Thyroid Awareness Month, I am speaking to you about saving your thyroid gland in the setting of nodular thyroid disease. I'm a general surgeon in beautiful Phoenix, Arizona, specializing in endocrine surgery as well as minimally invasive surgery. I'm a clinical faculty member at both the University of Arizona Medical School and at Creighton University School of Medicine. After removing hundreds of thyroid glands every year for the treatment of symptomatic benign thyroid disease, I now conclude that alternative minimally invasive techniques are simply better for the patient. Patients who have compression symptoms, which include foreign body sensation, difficulty with swallowing, worsening sleep apnea, as well as choking sensation, all benefit with thyroid surgery to alleviate these symptoms. With surgery, however, patients require removal of half or all of the thyroid gland. These operations are expensive and create hypothyroidism as well as a conspicuous neck scar. Many of these patients now require daily thyroid medication. Today, this extreme intervention is no longer required. With a complete endocrine evaluation, including thyroid ultrasound nodule classification and cytologic classification, we can now confirm that these nodules are benign, which means that they pose no significant future harm to the patient after removal or destruction. In this setting, proven benign thyroid nodules can either be left alone or can be destroyed using a new radiofrequency treatment. These symptoms experienced before this treatment resolve very quickly without surgery. This new treatment requires specialty training and equipment. For the physician with surgical dexterity, a comprehensive understanding of both ultrasound neck anatomy and thyroid pathology is essential. In the United States, few physicians have these capabilities. These procedures are only available in a few locations in the country, including a few premier university hospitals. However, with the critical expertise, these procedures can actually be performed in the office under local anesthesia. Before consideration for any procedure, the patient is thoroughly evaluated to ensure that the thyroid nodule is truly benign. This means that not one, but 2 biopsies are necessary. Sometimes the pathology returns with an indeterminate classification, which means that more tissue samples and analysis will be necessary before concluding that radiofrequency is appropriate. Many patients who seek this therapy are unfortunately disqualified because of suspicious or indeterminate cytologic reports. In this video, we clearly identify a comfortable patient undergoing radiofrequency ablation of her symptomatic benign thyroid nodule. Both the patient and I are protected with our N95 masks, and we are conversing normally. I am slowly advancing the RFA probe into the nodule. After confirming the exact position, the probe is activated and energy is transferred to the nodule. I am performing what is called the moving shot technique to slowly and methodically destroy the lesion. We do our best to ensure that the patient is comfortable throughout the entire procedure. After the RFA procedure, you are free to resume moderate activity and can eat and drink normally. The following day, many patients will return to work. I require the patients to return the following day to undergo a repeat examination. We discuss any concerns they experienced over the previous evening, such as discomfort or swelling. The patients then return to evaluate the volume reduction resulting from our treatment after 1 month, 3 months, and 6 months. We retest the thyroid function to prove that the function remains normal at either 1 or 3 months' time. Thus far, our results have been extremely satisfying for all patients who've undergone this therapy. The recovery has been minimal, and the symptoms from compression have resolved usually within 1 month and absolutely by 3 months. Our cosmesis scores also improved dramatically in a short time as well. We invite you to call to discuss your interest in this new treatment to determine if it might be an option for you. Telemedicine visits are also available after your medical information is received for our review. Thank you for taking your time to review this presentation from the Thyroid Nodule Treatment Center.